So for today's topic, which happens to be on dysmenorrhea, the first thing that I should be thinking of when I talk of dysmenorrhea is the definition. So the definition is nothing more than just cyclical menstrual pain. It is very similar to all the other dys in our body. It can be dysphagia, which is difficulty in swallowing, dyschezia, that is difficulty in passing stools. Similarly, dysmenorrhea. Menorrhea is a longer term for menses, so difficulty in menstruating comes under or is called as dysmenorrhea, and hence it is basically cyclical menstrual pain. This is in much contrast to chronic pelvic pain, which we shall be learning tomorrow, wherein there is going to be throughout the month. It is not going to be cyclical. It is going to be persistent throughout the month for a prolonged period of time. That is 6 months का pain. But यहाँ पे dysmenorrhea is something that occurs cyclically. There are going to be days when there is remission. In fact, there is a greater number of days every cycle when the female is going to have remission, in contrast to chronic pelvic pain, then there are a greater number of days when the female is going to have pain, and only a few days occasionally when she doesn't have pain. Whereas in dysmenorrhea, there are going to be a very few specific days, and those days are the days around her menstruation days, a few days prior and a few days after it has stopped. So, dysmenorrhea, everything, all the pain that relates in and around your menstruation. So, when I talk of this, there are there are multiple etiologies, but the basic classification is primary and secondary dysmenorrhea. So, when I talk of the first one, that is primary, it means that the dysmenorrhea is there without any pelvic pathology. So I have done the examination of the patient. I have done imaging studies like ultrasound, MRI, everything, but I have not been able to find any specific pathology. And yet the female is having pain. क्यों होता है वो सब हम पढ़ेंगे. Whereas secondary is with some pelvic pathology. What can those pelvic pathologies be? Things like endometriosis, or an extension of it is adenomyosis. You can be having ovarian cysts, fibroids, adhesions because of previous surgeries. So basically, various things, various pathologies in the pelvis, and secondary dysmenorrhea, whenever there is some other pathology which out of which byproduct of it is pain, is going to be secondary dysmenorrhea. I can understand why the pain in secondary dysmenorrhea is occurring, but what is the reason that pain should occur even without having any pathology? Now, one thing over here, that pain during menses is usual. Every female gets pain during menses, but what is unusual is going to be having excessive pain, which is causing functional problems, like like she's not able to function throughout the day. She's not able to work properly. It is affecting her social life. It is probably even affecting her sleep. Her entire schedule is disturbed, and she is always anxious that whenever she's going to get her menses, she's going to have such pain that debilitates her completely. So that is called as dysmenorrhea. Having pain in every menstruation is a physiological thing, but to have pain, and that pain is going to be affecting, disrupting your life, that is called as dysmenorrhea. So primary dysmenorrhea, why should it happen? So talking of primary dysmenorrhea, so when I talk of primary dysmenorrhea, first of all, I need to know why is there pain in first place. So the pain is because of the prostaglandins that are secreted by the secretory endometrium. यहाँ पे बहुत गौर करना है हमें ये दो वर्ड्स पे, secretory endometrium. Prostaglandins are being secreted by secretory endometrium. What is secretory? Secretory is that endometrium on which progesterone has acted already. So progesterone ने जिसके ऊपर काम किया गया है, that is going to be second secretory endometrium. Whereas endometrium, मतलब the presence of endometrium is one of the causes why that pain is occurring. You would think इसमें explain करने जैसा क्या है? You would know at a later point when I talk about the management part of it, how the absence of endometrium can be one of the ways that you can cure or you can treat primary dysmenorrhea. But before that, whenever there is secretory endometrium, so basically secretory hone ke liye there has to be progesterone in your system. So until there is progesterone in your system, which later is followed by progesterone withdrawal, which is basically the reason why this pain is occurring. So whenever you have prostaglandins, which are being secreted by the secretory endometrium, what will happen? You are going to have uterine contractility. The uterus contracts, obviously, which is why in every menstrual cycle you would be getting pain. For now, I'm talking about why is there a physiological cause of pain. So uterine contractility सबसे पहले होगा. Now, because of that uterine contractility, the blood vessels that are supplying the spiral arteries that are supplying the endometrium are going to be completely obliterated. This will lead to reduced blood flow to endometrium. Whenever there is reduction in the blood flow, there is going to be an increased painful stimulus that the nerve endings will get, noxious stimulus as we call it. So there is going to be an increased painful stimulus that is emanating, that is occurring, generated in the endometrium. So a painful stimulus through the nerve endings that are present in that endometrium. Now, all these three factors lead to menstrual pain. So, what is so different about primary dysmenorrhea? The difference in primary dysmenorrhea is over here. These prostaglandins, how are they created? उसके अंदर अपना आंसर बैठा हुआ है. Now, what happens in every month? Every month, you are having in your body a cycle of progesterone and estrogen. In the first 14 days, you are having estrogen, and in the next 14 days, if your cycle is of 28 days, you are having progesterone. So, towards your 28th day, there is going to be a progesterone withdrawal. So, around the time of menses, there is decrease in progesterone, which we call as progesterone withdrawal. This progesterone withdrawal leads to the production of lytic enzymes. बेसिकली क्या होता है जो लाइसोसोम्स होते हैं लाइसोसोम्स कंटेन सेवरल एंजाइम्स दैट कैन डिस्ट्रॉय एवरीथिंग दीज लाइसोसोम्स आर केप्ट स्टेबल बाय द प्रोजेस्ट्रॉन सो ये जब भी प्रोजेस्ट्रॉन जाके कम होने लगता है दीज लाइसोसोम्स लूज दैट स्टेबिलिटी एंड दे ब्रेक ओपन दैट लीड्स टू द रिलीज ऑफ लाइटिक एंजाइम्स लाइटिक आर बेसिकली ब्रेक डाउन एंजाइम्स दीज ब्रेक डाउन एंजाइम्स break down the endometrium